You paid for this eGFR blood test report and now the numbers look scary. You're waiting days for the doctor to interpret your report and tell you what it means. Breathe easy. Today, I'm going to decode the eGFR report for you so that you can make up your own mind about what it means. Why did this doctor even ask for this report? What are the real causes? Well, do you experience something like swollen ankles or swollen feet? Do you feel tired all the day, exhausted and constantly yawning? Do you feel like vomiting, or have you lost your appetite? Or do you even notice foamy or frothy urine when you pee and sometimes a puffy face in the morning? Well, all these are signs of poor kidney function, and it could be one of the reasons why the doctor decided to order an eGFR test. I am Dr. Bhargav Raut from PathoFast Lab Pune, and we process kidney tests all day, all week, all month, and we get asked all these questions about what these tests and their values actually mean, and that's what I'm going to decode for you today. I'll break your report into simple steps on which you can act. We'll cover what is eGFR, how is it calculated, why it matters more than creatinine, when is it reliable, and its limits. So to start with, eGFR stands for Estimated Glomerular Filtration Rate. Now what does that even mean? Glomerular filtration rate is basically the rate at which your kidneys filter the blood. Normally the kidneys take the blood, filter out all the toxins from it and pass them into the urine. This is basically the kidneys functioning like a big filter, just like you have at your society swimming pool. The rate at which this filter works is called the glomerular filtration rate, and what we want to estimate using this test is exactly this rate. A lower rate would mean that your kidneys are not filtering their blood properly and that all the toxins will pile up inside your body. So to start with, the eGFR is not measured directly. It is actually a calculation done on the level of creatinine in your blood together with your age, your gender, your ethnicity, and sometimes even your weight and height. That means it's actually a calculated estimate of how well your kidneys are filtering the blood and not an actually measured value, and it's always important to remember this. Two people with the same level of creatinine would have different eGFR values if their age and gender was different. Labs typically use a formula which is called the CKD-EPI equation to calculate this eGFR value from the serum creatinine. The formula predicts the filtration speed per minute per 1.73 square meter of body surface area. Just like we would use height, weight and age to calculate how much food somebody would need in a given day, the same way, combined with the creatinine, height, weight and age are used to figure out how well the kidney should be filtering the blood every day. Make sense? So why not just use creatinine? As it is, this eGFR value is being calculated on the basis of the creatinine. So why not use it? Well, that's because creatinine itself in the same person can vary a lot. It depends on things like diet, exercise, whether you have fever, if you're on certain medications, and so it's not a wholly reliable measure of kidney function, and that is why eGFR is used to adjust for these different factors. So what are the normal levels of eGFR? Well, usually a value above 90 is considered to be good and is classified as G1. Between 60 to 90, that is considered to be mildly reduced. Between 45 to 60, well, we call that G3A, and that is considered to be some amount of reduction in kidney function. Between 30 to 45, we call that grade as G3B, and that is definitely a reduction in kidney function. Between 15 to 30, it's called G4, and anything less than 15 is called G5, and that is called end stage of kidney failure. That means your kidneys are barely even working. So what to do depending on the value of eGFR? Well, let's take it grade by grade. Let's say that your value is not normal, but it's between 60 and 90. Well, usually if you have no other signs of any kind of kidney ailment, a doctor may consider to ignore it for the moment and just track it over time. On the other hand, if the value is between 30 and 60, the doctor will definitely look for additional tests, correlate it with your symptoms, and maybe even do a lifestyle review as well as checking you for other comorbidities. Severe or any value below 30 is going to require an immediate assessment of everything that is happening with your body, including medications, and this is probably something that a specialist is going to have to take a look for. Please note that for children or those who are below 18 years of age, eGFR is not accurate using the CKD-EPI equation, and a different equation is used to calculate this, which also takes into consideration their height. So you cannot apply the CKD-EPI equation for calculating the GFR for someone below 18. So I hope I was able to give you an overview of what this eGFR means and what you should be doing. Please consult your doctor before doing anything else, because this is to do with your kidneys and they are a very critical component of your body. If you are in Pune and you need an eGFR test, please consider calling PathoFast Lab. We offer home sample collection for all blood tests and provide you with reports like the eGFR within the same day or sometimes sometimes even within 2 to 3 hours. We provide accurate, reliable reports which are all verified by competent pathologists, and our reports are renowned for their accuracy and traceability over time. Thank you.